Assalamu alaikum, the communication day. We are starting with Mr. Saeed, 70 years. He underwent hip replacement surgery 2 weeks ago. While in the post-operative rehabilitation, he fell in the hospital and became confused since 1 week, which was attributed to UTI and transferred to the medical team who did CT brain, showed frontal bleeding. Meet the daughter, Miss Rihan, who doesn't know the result of the CT and discuss with her the condition of her father. Note that he was on prophylactic Clexane and antiplatelet prescribed by the ortho team. Okay, let's start after sharing the timer.
Okay. Hello,
Oh.
my name is Dr. Hassan. I'm a doctor in the medical clinic.
Nice to meet you, doctor.
I'm talking to Ms. Riham, a daughter of Mr.
Yes.
Saeed, 70
Yes.
years old.
Yes, doctor.
Okay, nice to meet you.
Nice to meet you, doctor.
Ms. Riham, we are here to discuss some issue related to your father condition. It's okay with you?
Okay, sure, sure.
Okay. Do you
Okay.
need anyone with you in this meeting?
No, doctor, no. Thank you.
Okay. Our conversation, if you need to ask me any question, don't hesitate to stop me and at any time. It's okay?
Okay.
Okay. Please, Ms. Riham, can tell me how much you know about your father condition?
Yes, doctor, sure. My father had fractured neck. Was admitted in hospital due to fractured neck surgery. He did well after the operation and went to rehabilitation. But doctor, his condition deteriorated since 1 week. One doctor told me there is something like bugs in his water work, but till now no improvement. Could you tell me, doctor, what is going on?
Yes, yes, you are right. Thank you for sharing this information with me. Do you have any expectation?
No, doctor. My father had a surgery, now in rehabilitation. No expectation.
Okay. Yes, you are right. Your father do this surgery for this fracture, and after that, your father when refer him for UT because the bug infection of waterwork to medical unit. He fell down, and after that became confused. Do for him CT scan, and the result of the CT scan now.
Fall down?
Yes,
No one told me about that.
I'm really sorry.
When he fall down, doctor, please.
He fell in hospital.
How fall in hospital? We are in era of medicine. How fall in hospital? And not anyone told me.
Felt after surgery, but mild felt, but after that became confused due to this, referred to medical department and decided to do some imaging for his brain, yes, and now the result came show bleeding in the brain tissue. Are you know this condition or experience?
No one told me about all of that. Just one doctor since 1 week told me there is bug infection in water work, and they will give him some medication. But since 1 week, no one told me about that.
I'm really sorry to first want to tell you about that. But if this occurs, there is innocent without intention, and I'm really sorry to tell you that, and please accept our apology. Your father now condition became now confused due to this bleeding in his brain. And also the other problem, he taking medication, causing blood thinning medication given by bone doctor. Um,
Okay, doctor.
are you following me?
Yes, I follow you, but I feel upset really. We are in the street or in hospital?
Yes,
How
in
my
hospital.
father fall? And you know, my father is
This
bedridden and
okay.
and wheelchair. How he fall?
Okay, I highly appreciate your concern, Miss Rihan. This can occur because but this not innocent and without intention can occur by mistake. But
I really
I'm
upset.
really
I
sorry
really
to
up.
think that.
I really
But your
upset.
father will improve and will follow him regularly, and I will
I
dealing with.
really, I really upset, doctor. I need to take my father from this hospital.
I highly appreciate your concern, but your father condition now not fully stable to take it. Um, I'm
Is my
really sorry.
father is my father going to die, doctor?
No, uh, um, no, your father condition will improve. Now he's good, but have some confusion due to this bleeding in his brain, as tell you before. I will, your father follow by specialist, which is best interest of your father condition. Um,
Okay,
have
doctor.
any concern?
Yes, I concern about raising a complaint.
No problem.
I think there is a negligence of my father.
I highly appreciate your concern. I highly appreciate your concern. I will write. I will. You have a right to complain. I will guide you and help you and show the right step to do complaint in the patient adversary and liaison services. And also, I will write this in electronic record and will do. I will. I will. I will inform the medical health team and medical director and our supervisor, and I will I will do investigation and action to prevent this from occurring again. But as tell me if you want to complain, this your right. Or this not affect your father? Be sure this not affect your father care.
Okay, doctor. Okay,
Do you have
thank
any
you.
other questions?
Yes, I concern about what is the condition now of my father.
Now your father have brain bleeding inside brain in his brain, in front of his brain, and also have post-operative, as you know, from this fracture, and also have bug infection in the waterwork. But I will follow him and treat him as well. I will ask you some question about your father. Are you, what is your father job?
2 minutes left.
Businessman, but he is retired. He is now wheelchaired.
It is financially supported.
Yes, yes, doctor, no problem.
Okay. Who live with your father?
He live alone.
Okay. I will refer you to social worker and occupational health worker. I refer to social worker.
What can social work with me, doctor? He live alone, so I bring him a lot in hospital. Um,
can deal with him because after this bleeding may have some disability. May need care. If left alone, we may need more care. I will refer you to social. May can help you.
Okay,
I will give you.
what can social worker give to my father?
Yes, maybe give him a home nurse and help him more. Can give him.
Okay, doctor, thank you. Thank you very much.
I will give you also leaflet and brochures and website and our contact number to call us if you want. At any time, don't hesitate to call us.
Okay,
Thank
doctor.
you.
Thank you, doctor. Thank you. I am sorry, Dr. Samir. I am very sorry.
Okay, 10 seconds remains. Anyone, any question you want to ask?
Me, Iris, 6 minutes. You give me 4 minutes from
Okay, so you're Irish. Yes, sorry. Okay,
Mhm.
good also to have this time to know more about this scenario. Okay, well done, Dr. Samah. Let's hear Dr. Mahmoud, then I will comment.
Yes, this scenario, Dr. Samah, patient felt since 1 week in hospital and was attributed. Doctor think that the disturbed conscious level or decreased conscious level due to UTI, but patient felt. So he has brain bleeding. Despite that, doctor didn't do CT until 1 week. After the fall, 1 week. This case has 3 mistakes. First, patient fall didn't tell the daughter or the next of kin. That is the first negligence. We should admit and the incident report and inform also the consultant. Second mistake about the incident, the accident itself. The patient falls since 1 week. We didn't do the CT until after that 1 week. So it is a second negligence. Third negligence, and I don't know why, but because patient on Clexane and antiplatelet. Why patient in Clexane and antiplatelet? We will say that we will tell the patient that your father has dual blood thinner. We don't know why. It is bone consultant, and we will write it also in the incident report and refer this incident report to high risk management team to investigate further. And a lot of appreciate. I am sorry. I know it is our mistake like that, but you did it well. Thank you, Dr. Samah, and I am very sorry for this case.
Yeah, thank you, Dr. Mahmoud, for the scenario. So the task here and the good news in the exam, they will write for you what the task. Dr. Mahmoud didn't mention it, but again,
Yes.
Yeah, but it's okay. Just to learn how to deal with the hidden agenda. This scenario, if you consider like hidden agenda, it's clear. Patient fall in the hospital. He told you, is he in the street? Yes, he can't be in this situation at hospital. No patient will fall down in the hospital. There is a lot of precautions should be taken in a risky patient to fall. First thing, they will label him in the file like risk of falling. The second thing, they will put aside rails. They will close the bed and side rails. The third precaution, nurse watching him if he has risk to fall. If all this broken, the chain means the chain's broken means there is a big mistake. So this is the mistake here, and it's a clear medical error. You have to apologize for every simple mistake in this scenario. You apologize in the first, this which is good, perfect. You have to apologize. First thing to say, I apologize, and you have to admit the mistake. But this is the main bulk of the scenario. I will go back to the introduction. You have to ask, are you the next of kin for Mr. Said? Yes, I am. Don't invite someone to attend the meeting if you have another person you are talking about, unless you assume he is comatose or he's not having any capacity. Since he's confused, so you don't know if he is fully awake or he is fully comatose, no need to invite anyone in this situation. Okay? If Mr. Said is confirmed that he lost the capacity and he's comatose totally, that time only you can invite someone. And you have to assure the confidentiality because this patient has confidentiality and you have to keep it confidential between him and the one you are talking with him. So once you invite someone to attend, means that you breach the confidentiality. This is the first thing in the introduction. The age, the name, confirmation, and the invite. You no need to invite here. And the next of kin. You have to confirm this is the next of kin, that she is the one taking care of him and she is the one following him usually. Because she might tell you, no, I am not the one and I don't know anything about him. So you have to assume that, or you ask her, you are the next of kin. You have to ask this question, okay? This is the third step. What do you know about your father so far? He or she will tell you the condition from A to Z if she knows. But if she doesn't, as in this scenario, so there is some gaps, and you have also to treat or to manage this issue. Why she didn't know everything? He told you many times, no one told me, no one told me. So there is defect, no communication. You can ask her why you didn't come before. You are not following him. You are not of the next of kin. Is the mistake from her side or from our side? And if there is mistake from our side for the communication, this is another error. And again, we have to apologize for that. Okay, then the expectation as you ask, you finish the steps well. You did it in the stepwise manner. And this is what you are learned today, how to follow the steps. Then the explanation, what happened to him, you have to say what happened exactly without hidden. And as we are saying, duty of candor, you have to be honest with the daughter. Patient fall because of our mistake. He was not followed by nurse. No one was behind him or no one was aware about him. And this is a mistake. I am so sorry. And on behalf of the whole team, I am here to apologize. You have to say this from the first sentence. So you have to admit and to apologize in the same time. What you are saying, doctor? Are you serious? She will react, of course, because this is her father. I'm so sorry again for what happened to your father. We are here to take care of him. We had an action immediately. We called the doctors and they did the action. Suppose the CT brain if he's not awake. And we call multiple doctors or multi doctors or a group of doctors to follow him. We are caring about him. Don't worry, we are trying to take care of Mr. Saeed and we will give him the maximum support he needs and so on. This is regarding the mistake and the error. And you have to explain what happened in the CT. We found that there is a bleed in his brain and because of the fall down. Now we will go to the prophylactic Clexane and Plavix. If no indication for Plavix in this scenario, this is another mistake. And you have also to apologize for it. But if there is indication, it will be medical, complication. Maybe this patient is ischemic heart disease. You don't know the details of him, right? But if prescribed wrong or overestimated, why he prescribed or the consultant prescribed for him Plavix? Why the orthopedic prescribed Plavix? This is not the task of the orthopedic, right? The orthopedic usually prescribing the prophylactic anticoagulant. Clexane only. Why he will prescribe Plavix unless the patient on home Plavix for ischemic heart disease or for previous stroke. So you have to address this issue. Does he on any medication for stroke or any heart problem? If he said or she said yes, so this is medical, not medical error, it's a complication for the Plavix. But if no indication for Plavix, you have to apologize for this. Again, if you don't know the whole situation, you can tell her we will investigate why he is on this two blood thinner, and I will be back with you to explain and to give you further explanation. Again, if you have mistakes and error, you have to follow the other steps of medical error, which are incident report. We inform our nurse supervisor why he could fall in the hospital, and then the nursing office will follow up this issue along with root cause analysis to analyze the event. And the next step, we had also inform our consultant. He's aware about this and he's arranging a meeting to discuss about this issue and this mistake in order to prevent it from happening again. We had at the end of the month mortality and morbidity meeting. Don't bother about the name. It's a name of meeting that we are discussing the issues happened in the month or and in the department per month. And if you are caring for the update, I can update you about the incident report or the investigation, root cause analysis. Let's go to his concern. I will complain. Yes, as you said, this is your right, and I can guide you to the office responsible for that. Patient advice liaison services, they are the one receiving the complaints, and I will guide you to them. And be sure that we will not affect the care for Mr. Saeed, and be sure that what happened was a mistake. It's not intentionally happened. Then 2 minutes, you will ask the concern and you ask for the support, but no need to ask for social work as the patient is still in the hospital. Does he need any support? No, thank you. Does he live with someone? Yes. Anyone need help to help him? No, doctor, thank you. Okay, we can involve our occupational therapist to provide him with some tools, help him to walk again or to mobilize again or to ambulate again according to the condition he will be on after discharge, if he's fine, of course. And leaflet brochures, website, and so on at the end, okay? This is the way how to do medical error and the best scenario in exam, the medical error. There is a scheme and steps you have to follow it from you enter the station till the end, okay? Different than other scenario like counsel about disease. Yeah, there is steps, but you don't have skeleton to talk about and steps to follow. In this scenario, you can have 3 steps to fulfill: the medical error, the incident report, the admission, the apologize, and apologize every time and now and then for the mistake and so on. But for the counseling, sometimes you don't have the clinical knowledge to give the patient explanation about the disease or the medication. Sometimes you don't know, you are not familiar with this medication. Sometimes you have to say, I will consult my senior to give you an answer and so on. But medical error, you can fulfill the criteria of the scenario alone without referring him to another senior or apart from the meeting with the consultant for the medical error. Is it clear, Dr. Samah?
Clear, yes. بس have one question.
Yes, sure.
In start not reading scenario well. Reading the first line, and after that read the result of CT scan show, and then talk to Miss Fulana daughter. Due to this, I think this came to inform her after
No, it's
start.
okay also to say like that. If it's
Difficult for me because till now knew not different between
no,
all
Dr. Samah, let me tell you that you did it as
uh,
a beginner, as you are assuming yourself as beginner, you did it perfect, really.
thank
At least you admit the mistake and you did the steps of medical error. This is at least as a start, very good for me.
you.
Okay. So no need to be worried. With the time, you will be more practiced and you will be more professional. Don't worry about that. It comes with
No,
time.
came for you to become more strong because يعني I'm teaching more from you. Oh, I'm learning more from you.
Doctor, I
I'm really
appreciate that. Yes, I appreciate wallahi that. But please, uh, learn
Okay.
more and read more, and you will be, believe me, you will be professional. Wallah, it's a matter of
Okay.
practice.
I'm so
Okay.
lazy, but we will try, inshallah.
No, but
No.
Dr. Samah, it will really.
Don't lose your
Yes,
trust
I
Dr.
and
Basim,
Really,
confidence. Yes.
you're really
Yes.
today. Good.
يعني هو
I
uncle, man.
don't. Yes, sure, sure.
حياكم السلام خير.
thank you.
Just for yeah, for the beginning, the next 15 usually, as you said, usually better to keep it for sensitive scenarios like DNR or organ donation or like that. But for a patient like this, better to avoid. Even it will not minus you in the marking in the exam. If you didn't ask for the attender that you do need anyone to attend with us or to the meeting, they will not affect your score in the exam. But don't make it يعني as a routine for every scenario. Second thing, just to avoid Dr. Samah, as you said, you are a beginner, better to avoid in the next try to avoid jargons. CT scan
Mm,
is the jargon. Yeah, just try to use imaging for any image. Use imaging. It's easy, and for MRI, ultrasound, anything, it is imaging. This is the second thing. I think the third point, I think I missed it. Anyway, this is the two things I want to talk about it. Thank you, Dr. Basim, for your all
Okay.
support.
Thank you, Dr. Ahmed, for your advice. I will answer the two question, or I will comment on the first part of your comment, which is the next of kin. Usually, whenever you are sitting with someone related or relative to the patient, we are asking this question even in the real life. Who are you? Are you the son? Are you the first degree for him, right? So in UK, this is the same question, but in another way. Are you the next of kin? So I don't think it's problematic to ask this question in the basis. The second thing, the invite. Yes, what I know in the whole basis, you are not inviting unless you are talking to the patient himself. But if you are talking to the relative, so who you'll advise? So let's say this is the daughter, and if she said, "I will invite my husband," does he have the relation to know the details of of his father-in-law? I don't think so. This is also my opinion. Anyway, I'm not saying you have to do that. If you hear something else from another area and you want to do it, and you are feeling okay with it, you can do it. But I am always saying what I am practicing, and I guess this is in the real and in the practice wise, it's accepted. The third question or the third comment was about the jargon. Yes, she did a jargon when she said we did city brain, but the good thing she corrected in it in the next sentence. She said we did an image for his brain and it showed bleed. So whenever you are saying jargon, correct it or explain it in simple words immediately after you pronounce it. For example, in this scenario, she said, "Yeah, city brain and it showed bleed." In the next sentence, immediately she should and she must say, "The CT is an image to show us how the brain condition is." This is the way how to correct the medical jargon. Apart from this, thank you for your comment, Dr. Ahmed. And always, you are welcome to comment. Please feel free to comment to have the confidence. I guess, Dr. Samah, if you talk more, you will get more confidence. Don't just write in the chat box. I need you to talk to have the confidence how to practice with verbal communication. You got it?
Okay. طيب, I have other question. If
Yes.
say this jargon, صح? Said without
Yeah.
CT, do scanning for head show كده. This jargon
Yes.
or not?
No, no, no. Scan is not jargon. We scan
Scan
his
is not.
brain. No, no. We scan
Oh,
his brain and it showed that. We did image to his brain and it showed that like this.
لكن I think said image, صح? Said I'm sure
Yeah,
100%
yeah,
said
yeah. You
image.
said image. Yes, you said image in the next sentence. That's why it's accepted.
Yeah.
but don't let it without explanation. Don't say it and leave it to guess it, or don't let him ask you what you mean, doctor, by CT brain. If he asks you this question, definitely you will have minus for the jargon. They will minus you on the jargon or for the clinical communication. Mention a jargon. It will be written in your comment. Okay.
Okay.
Okay. Any question or any comment from others, please? Dr. Samah, now give scenario to Dr. Mahmoud.
Okay. Ready.
Ready. Okay. Medical error, yes. Can someone share the scenario? Yes, thanks. I will read the comments until you share. Do we need to explain plan of management? Well, yes, definitely you have to do it. Why you mentioned the multidisciplinary team here, but as a group of doctors? Why? Because he had now multiple problems. And this is your action you are taking after the mistake. And if you didn't show the action, means you didn't deal with the mistake. So the first thing is to do here is to invite a group of doctors, starting from the neurologist for the intracranial hemorrhage or the bleeding, and for the respiratory, for example, if he has aspiration, dietitian to provide him with food or feeding, and also orthopedic, one of the primary and permanent team for him, as well as the hematology or blood doctor for the blood thinning medication. This is the way how to involve a team or to collect a group of doctors to deal with this mistake. Whenever you did mistake in the hospital, you are correcting it immediately by this action, right? So show the daughter that we did an action. We didn't stop there and we let your father in his late or delayed discover. Although it's late discover, but we had an action. It's a matter of showing the examiner that you are dealing with the mistakes well and in professional way. Okay. Well done, Dr. Samah. Yes, all the steps perfect. This is also my opinion. She said image, yes. Okay. Dr. Mahmoud, you are the specialist registrar in the respiratory clinic. You are interviewing Miss Jana, 46 years old, who having suspicious mass in her lungs or in her lung provided by X-ray. She have history of loss of weight and coughing up blood. She is smoker about 25 years. Your consultant plan for thoracoscopy, VATS, video assistant thoracoscopy. So VATS, not VAST, okay? To take sample from this mass for more evaluation, please to talk to her and take her consent. I will give you 2 minutes. And once you're ready, let me know.
ستارت على طول يا دكتور باسم
Okay.
ستارت يا باشا.
Just write some steps you have to fulfill. This scenario is tricky. So write some steps you have to follow it in the discussion. 15 seconds. I will give you like pause for 15 seconds just to write some sentence you have to ask about and you have to do it.
Let's start.
Okay, here you go.
Good morning. I am Dr. Musa, doctor in the clinic today. Could you confirm to me? What's your
Yes,
name? What's your name, please?
Miss Jana.
Jala. Okay, Miss Jala. Nice to meet
Jana,
you.
Jana, Jana,
Jana.
Jana.
Okay. Okay. We are here to discuss about your condition and the result of your scans. Is it okay with you?
It's okay.
Okay, Mrs. Jana. How much you know about your condition?
I developed coughing blood, weight loss, and became more dizzy. Oh, shortness of breath came to respiratory. OBD tell me need to do chest X-ray. After do chest X-ray, tell me maybe cancer, but I don't know what. Okay.
Okay, Mrs. Jana, how do you feel now?
I'm fine,
Okay,
but
Mrs.
so
Jana.
so worried and anxious about this result.
I'm very sorry for your suffering. Mrs. Jana, the result of your scans and investigation have been released. And I am sorry, I have some bad news for you.
Okay.
You are with me? You are with me, Jana?
Yes, with you.
Okay, Ms. Jana. Actually, the result of your the scan of your lung revealed that you have a suspicious of a nasty growth in your lung.
Okay.
Okay, lung. This nasty growth has a lot of types, and each type has its own treatment, its own medication. So after discussion with our consultant, he recommended to do a procedure called video-assisted thoracoscopy. Do you ever heard about this?
No.
Okay, Ms. Jana, let me explain about this procedure.
Yes, please.
Okay, this procedure, you will come fasting in the morning. It will take in the theater. It is minor surgery. It will be done. It will be done under complete sterilization. We will give you some medication to give you some some sedation, and give you some spray, and with special and we will introduce a special tube between your ribs. It is usually between 5 and 6 ribs. And we will take it will be done under camera test, and then we will take a snip from this lesion in your lung, and send it to be examined under microscope. This is a this snip is very important in your diagnosis and the outcome of your disease. It will give us the diagnosis of if it is already cancer or not cancer, anything other than cancer, and it also will predict the outcome and the prognosis of your condition. So it is very important. This procedure, like any procedure, has its own complication. Like maybe feel pain, minimal pain is expected, but if you feel severe pain, you should report it to the doctor. Also, maybe bleeding or introduce some bug into your lung. May also have coughing of blood. Minimal coughing of blood is expected, but if you have severe coughing of blood or shortness of breath or breathlessness, you should report it at once to the doctor. So what do you think? Are you following me? I'm really sorry for this bad news today, Mrs. Jana.
Yes.
I'm really sorry. I know it's hard for you. I'm very sorry. So what do you think? You will agree?
No need. No, not agree.
Mrs. Jana, as I told you, it is highly suspicious of cancer. Cancer has a lot of symptoms and complication like your symptoms like loss of weight or coughing of blood and fatigue. Maybe by time this nasty growth will spread to other parts of the body like the bone and the liver or the brain. It will be you will be in a bad condition if this cancer is spread. So what do you think?
No,
Why
no need this. No
can
need
can
this.
can I know why you are refusing?
Yes, I have needle phobia and procedure phobia.
This complication will done under camera test and with a special needed special needle will give you some sedation. This procedure will be done by our expert doctor who did it many times ago with minimal complication. So you will not feel just minimal pain, but outweighing the benefit and the risks from this procedure, the benefit are more. You will receive the treatment early. We can treatment this cancer early. Many cancers of the lung, if treated early, it will be a good prognosis. So it is better to do this procedure. What do you think?
No, I have no time. No need to do because I have a wedding of my sister. I will do.
Congratulations for your sister. Congratulations for that. But you should put your health in a priority. We can do this procedure. Just it will take 14 minutes. So you can come in the morning and get monitoring after that for 4 hours and go home and go to the wedding. So no problem, not complicated.
2 minutes left.
So what do you think?
It can go through airplane without any complication.
With the airplane. Okay, if it will be assessed by our consultant before you have traveling to by plane, and I will be back with the opinion of the consultant. So it is okay with you?
No.
Okay, I can arrange another meeting, and you can share this with your family. And if you need to arrange another meeting with my consultant, I will happy to do that. And if you agree to do this procedure, you have signed consent, which all information is mentioned. You must read it clearly. And if you change your mind, it's your right. You can withdraw at any time. Okay. Okay. Did you accept?
Yes.
Okay. Very good. Okay. I will give you some brochure and leaflet and some YouTube links that with this procedure, and you can contact us at any time. I will give you the contact number of our department. Can you told me how much you get from our conversation?
Yes, we do this procedure, but you tell me can travel normally. If this not allowed, I cancel this procedure.
Okay, I will
Talk
arrange
to your consultant versions and tell me.
Okay, I will arrange another meeting with my consultant to discuss about traveling by plane. Okay, thank you.
Okay, time is up. Well done, Dr. Mahmoud. This here, Dr. Yeah, Dr. Samah, can you comment? Then I will comment.
حاسة في حاجات مساها يعني في حاجات miss something. last things after said for you, I willing to do this procedure. I'm agree. Not ask me about blood thinning medication and
Yes,
blood
yes, yes,
investigation for blood. This is important for any procedure. And
yes, yes.
also, not tell me about the good risk, the good or benefit or advantage of procedure and disadvantage. Not tell me about the disadvantage.
Tell
Pain,
pain.
injury,
I
bug
told you.
infection.
Yes, yes, I told.
Told
Pain.
you?
Yes, yes.
Okay.
Yeah, he
Pain,
Okay,
mentioned them.
okay.
pain, bleeding,
عملت
diffuse
عملت
attacks.
فيها نجمة.
I,
دو
wa-
ستار. Okay.
I was,
Maybe signal problem. Okay.
كويس ما نسيتش الكونسنت في الاخر
But other doing well. Done.
طب about الايربلين دكتوره سماح.
Mm.
What is the answer? Airplane. Traveling by
I think not allowed after operation directly. I need have no time. يعني this marriage أو wedding يعني now in this period. How do this procedure is not easy يعني maybe develop bleeding something like that. Not allowed.
Okay, we'll come to this point. Yes, we'll come to this point at the end.
Mm.
Okay, any other comments?
After tell you about needle phobia, you tell me we'll give you some medication to numb this area and use this small needles, no pain, like this answer is good, this concern. Oh, no need, you tell me your priority, your health have priority for your health. But this concern of airplane also answered by true way. You said I will ask the consultant because not give me wrong wrong answer.
Yes, wrong
Okay.
information. Yeah.
Thank you. Wrong information. Yes.
Okay, thank you, Dr. Samah. Well done, Dr. Mahmoud. Apart from some mistakes, in the top of them, the jargons. And the jargons is very dangerous. You are saying rings and sedation.
Yes,
and
yes, yes.
Yeah, try to avoid these words. So the ribs, what you can say ribs in medical term, and not none in medical term, or none in non-medical term. Ribs.
Chest bones.
Yeah, chest bones.
Chest bone.
Excellent, excellent. Yes, and for the sedation,
Painkiller.
painkiller
medication.
or numbing medication. Exactly. Yes. One more you mentioned in the in the steps jargon.
Sterilization.
Yes, sterilization. Perfect. You know, and you know the mistakes. Okay.
Exactly.
So what are or what is the alternative word?
I don't know.
Simply, what you are doing in the skin.
Can use
Disinfect.
by using some solution or to keep it.
So all
clean.
this in one word: cleaning. Cleaning.
Cleaning. Yes,
Yes,
cleaning.
just cleaning the skin. Simply, yes. So we are cleaning the area when we are, or the area where we are breaking or going through in the skin. And also we are numbing this area in order not to feel any pain. If she had any needle phobia, you can treat it or you can deal with it either by giving some numbness medication. She will not feel also this needle, I mean the local injection. And we can involve our pain management doctor. He is perfect on doing that. That's it, more than enough. Let's start from the beginning. As the introduction, you have to know the patient name. Don't tell her what's your name. And the name, the age. So the name and the age, you have to write them in your paper.
Not in the case. مش جانا صح.
Then, that's why I told you, take your time. These things, you have to write them, starting from the name and the age at the left corner, then the introduction, the expectation, and the case about, and the social support in the down corner, and also the smoking alcohol in the other corner, and in the middle, the drawing or the procedure or the task itself in the middle of your paper. So you will focus on this issue, which is the procedure. Okay, let's start again as introduction and expectation. And you didn't ask about expectation, better to ask. And by herself, she said, I guess there is cancer. But again, you kept us telling her the result as not, she said already, I hear there is a cancer. So you can tell her, yes, I am afraid to say there is a possibility of cancer. So this scenario is cancer uncertainty. There is a possibility of cancer appeared in the scans or the image, and for that we have to confirm the diagnosis. No need to say in direct way this is in nested growth and so on. So cancer is cancer, but it's still
Cancer is
possibility.
cancer. Mhm.
Yeah, cancer is not jargon, and it's I prefer to say cancer. People, everyone, even the Arabic culture knows cancer words. So it's not jargon at all. Cancer, everyone knows, even the kids, they are aware about cancer. Okay,
Mhm.
so you can say you have a cancer, possibility of cancer, and for this we have to admit and to run some other investigation or some other scans, which is snip from this cancer to confirm the diagnosis. Okay, what are the steps for that? You have to be admitted, you have to be fasting, as you said. If you are taking some blood thinner medication, you can stop it, and we will be sure that your blood profile is okay and suitable to proceed with this SNP. Okay, this is for before. And of course, the consent form, you can say it at the end. This is the before, step before. And during we will clean your area of skin, which will go through it. We are using a camera scan. We will go through the bone or between the bones, the chest bone, going toward the lung and directly to the mass or the cancer to get a snip from the cancer tissue. Then we will analyze this by doing some further workup by our laboratory team or whatever. It's no need to mention it. But anyway, we will analyze this SNP to be sure that it's not a cancer or a cancer. And accordingly, we will deal with your condition. Okay? This is during. So the next is after. What will happen? You can explain the side effect. As you said, injury. This is very common. Injury means maybe pneumothorax or whatever, but you can say injury only. Injury to your other organ in the chest or bleeding in the same area of the chest or infection later on, although it's very minimal because we are doing this many times as you did. And if this happen, we will interact immediately with this complication, which is very rare. You have to reassure here. Then after that, you will stay for couples of hours under monitoring observation for any complication. The good thing you mentioned some side effects. Please, if you feel short of breath, if you feel cough of blood, don't hesitate to come back. But this safety netting, you can say it at the end, not in the, because we already monitoring here in the recovery or the daycare. We are monitoring for this complication. You can say it at the end. Okay, before going home, please, if you felt unwell, your breathing becomes short or difficult to breathe or coughing up blood, please contact us immediately or come to our hospital immediately. This is for the red flag or the safety netting. But before this, you can talk about the consent. How do you feel about this, Mrs. Jana? Are you agree to do that? No, doctor, I have one, two, three. So every concern you have to address as you did. So you started by the first concern, needle phobia. Okay, covered by numbness medication. Don't worry, you will not see the needle. It's very small needle, even though after that you will not see it again and you will not feel it. Finish the needle phobia. The second, I have wedding. I appreciate your social issue, and we are here to help you in this. Our greetings to your sister. It's important to do this as you did, and we can finish it in couple of hours if you can join the meeting or the wedding tomorrow. When is the wedding? She will tell you, for example, tomorrow or after tomorrow. But if with flight, no, it's not allowed. So the only way here is to offer her virtual meeting. You can see your sister wedding by using virtual meeting or social media or video call or whatever. This is one of the solution for wedding or any social event related to the patient, and it's important to attend this meeting. You can offer it in any scenario for TB patient with isolation, for patient undergo surgery, or he will be admitted, or he should be under monitoring for anemia or for scopy. So this is one of the solution. If he has some social issue outside, you can offer this if the patient will be at the hospital. But if he can go safely, so finish the procedure and let her go. In this scenario, never ever she can go because of the flight. For how long? No one will be sure. I'm not sure also. Just say for certain days, I'm not sure about, you have to stay without flight. And I will contact my consultant, my team, or my senior to be back with sure information. The flight for post VATS, I guess it's within week. If everything okay, the chest X-ray is okay, the patient can, but I am not sure also. So don't give frame of time. Just say I'm not sure about, but you have to keep away from flight for couple of days until I will confirm for you how many days, and after that you can either fly safely or not. Okay. Then at the closure, thank you for your time. Are you agree to do this? This is the consent form. Please read it carefully. Anytime you feel hesitant or change your mind, please, it's your right to change or withdraw. But this consent should be signed at the end if you agree for this procedure. Thank her, and if you have some time, you can touch the support and the job. Of course, very important. The job, maybe it's working in the industry or something with toxins. You have to address this issue if you have
Yes.
time. Yeah. Smoking, because now is still uncertainty, and the smoking will be related. I know some doctors will tell me why this patient is already has a cancer, so why you are advising about smoking. If the patient is terminal, okay, don't offer smoking cessation. But if you have time, and the patient is a smoker, you can ask her and you can advise her, please stop your smoking. It's worsening the cancer and general condition. But if you don't have, this is not the main task in the scenario. So the job and the smoking, if you have time after all the steps I mentioned, because it's long scenario, explaining the cancer and explaining the procedure. By the way, you didn't draw, you can draw, Dr. Mahmoud. You can just make the lung and the chest bone and the camera scan going like this. Simply don't be complicated in the drawing. Okay, this is the scenario, how to go through it. Nice scenario, and it's common scenario, by the way. Any procedure common in the basis. Any question, Dr. Mahmoud?
Thank you. Thank you, Dr. Bassem. Thank you very much.
Most welcome, Dr.
Thank
Samah.
you.
Most welcome, Dr. Mahmoud. You are doing great, Dr. Mahmoud, by the way. It's
Thank you.
it's just the matter of jargons and yeah, and how to go through the steps. I mean, frequently, and you will be professional with the practice. Okay.
Okay. Okay. Thank you, Doctor. Thank you,
Most
Dr. Bassem.
welcome. Okay, thank you. Dr. Samah, any question?
No, thank you. Good.
Okay. Someone wrote here, yes, sedation. I will read the comments. Draw, sedation, yes. Cage.
Yes.
I don't think cage is accepted also as, you mean thoracic cage, right? But it's difficult also as the cage. Bone
Long,
is,
chest bone
chin
best.
bone is the best. Yes, any bone in the body you can say bone. So the bone, for example, the bone of your head bone, the neck bone, the backbone, the hip bone, the long bone, any bone you can mention as bone. Okay, the arm bone, the leg bone, any bone is accepted. But To name the bone itself, jargon. To say, for example, humerus, how the patient will know the humerus. So you can say arm bone or leg bone or here chest bone. The same when you are saying about CPR, we are avoiding the CPR or do not attempt resuscitation. I mean, you are saying we are not willing to do heart massage because we are going to do fracture or to injure the bone of the chest. It's the same concept, okay? Yes, you can draw, as Dr. Samah said, cleaning solution. Yes, I am talking to Miss Jana, 46 years. Yes, of course, you can start like this. There is no flight for 2 to 3 weeks, Dr. Muhammad Mustafa.
Yes, 2 to 3.
After
I
uncomplicated
um
VATS.
do searching now.
Okay,
2 to 3
good.
weeks. Yes.
Yeah, 2 to 3 weeks. I guess
Mm.
if they did plurectomy, it will be shorter than this, but I'm not sure also. So the plurectomy means no pleura at all. So you are not worried about flight and collection of air. But in this scenario, yes, the pleura is intact after the surgery. There is possibility to have complication or pneumothorax. So it will be, yes, accepted to be longer than this. Maybe I mentioned the 1 week for plurectomy. Okay. Dr. Zoom, thank you. Nice session. Yes. It's nice by your practice and your sharing and your comments. Anyone has other comments, please let us know, or I will choose myself. Okay, let me choose, for example, Dr. Azhar here. So, first person to ask. What's your expectation about these two scenarios, Dr. Azhar?
Assalamu alaikum.
Alaikum assalam. Yes.
First of all, I'm very, very grateful to you. MashaAllah, you have very good knowledge and your way of explanation is very, very nice. I'm very happy, very, very happy.
Thank you so much, Dr. Azhar, wallahi, for your words. Nice, very nice and kind words. I I appreciate that, really.
And we are learning a lot from you.
Thank you so much. Thank you, Dr. Azhar. And
You
I am
already explained each everything. I don't think so that we have any chance to explain.
thank
Uh,
you so much.
I admit that, Dr. Azhar. I admit.
Thank you.
admit.
Really, wallahi,
Write
I
report
appreciate.
to
Is
inform.
this for Dr. Basim or for all of us?
Really. Admit
Dr.
to
Azhar?
inform.
Yeah, really, this meeting by your attendance, wallahi, everything with your attendance will be great and helpful for others. What if I attend this meeting alone? So this meeting by your attendance getting more helpful and beneficial for others. So it's not only me, it's also you. Thank you, Dr. Azhar and Dr. Mahmoud, for your words. Any other comment?
to the extent I know, what about the CT? I have
Yes.
what I know about CT, and many people say that CT is not a jargon, but I do not know exactly.
But best to avoid it. If any things have think
For example,
to
if there is
thinking, should
scenario,
avoid it. Yes.
for example, if we have a scenario and we first we did the CT and we want to confirm our that disease further by MRI. So how we will say we have done one scan and we will do another scan. So
Yes. Yes, it's like that, Dr. Azhar. And this is advanced scan different than the previous scan. And you're not just talking, by the way, the patients and the relatives now being more aware by Google. They are using Google for each word you are saying. So whenever you finish saying we have an MRI, they will finish with you and they will Google what is MRI and they will see what the side effect of MRI according to the language of the relative. So they can search in Arabic or in English and they can translate or whatever. So be at the level of the family. They are now aware about everything. So if you said there is, we'll do scan. Oh my God, but it didn't show anything. So we will going to do another scan. So what the difference? Why you choose the other scan if you have a previous scan? You have to explain this is another advanced scan and it showed more clear image than the previous scan. and you can name both of them. That's why I don't prefer to say CT, because the CT is abbreviation for what? Computerized tomography. It's very complicated jargon. So
Yes.
simply, yeah, yes. So simply you can say we will do scan, initial scan to show the brain, for example, or whatever you are for the mass. But if you have no finding or no clear finding, we are going to do a more advanced scan called MRI, magnetic resonant imaging, and this is using a magnetic field that it will show the tissue more clear than the other or the previous image, which is called CT. So I prefer to say a scan and image, and you can explain it. The difference of, for example, between CT and MRI. Any jargon or any medical term in the medicine, you can simply explain it. You are able to do that. No worry about that, because you are the best educational level in the culture, right? So you know how to make it easy, and you make it simple, and you can talk it in medical term, as you are talking to your friend in non-medical term field, and you are talking to your colleague in the medical field. You are not saying to your friend in this, for example, your neighbor, we did the CT and it showed. No, you are talking. We did some scans. The same in the exam. Imagine this surrogate as a friend in non-medical field. Talk with him simply, and whenever you are using a jargon or medical term, explain it more simple. Okay. This is my opinion. If you want for it's okay, and if you have another opinion or you have another school, you can follow. But I prefer to do it than to explain it, or not to do the medical term at all. But I will talk in simple way. Okay.
Yes, yes. And second thing is, on Thursday, I'm going Pakistan for 3 weeks. And and maybe in Pakistan, maybe I cannot get the time. If I will get the time, inshallah, I will be with you, inshallah, in Pakistan.
Thank you
So
so much. It's really appreciated to be with us in the meeting. Really, you are sharing good and precious information. And also, I will miss the case practice with you. But I will wait for you, inshallah.
inshallah, when I have time in Pakistan,
No
inshallah.
problem. Take your time. Enjoy your time with your family. May Allah bless you and them. Thank you, Dr. Azhar. Thank you also for reminding us.
Thank you
Your
very much.
presence always is appreciated.
Thank you, thank you, thank you.
Most welcome, dear. Most welcome. Okay, thank you. Any other question or comment from others, please? Okay, it seems no comment. Everything is clear so far. I will read the last comment, Dr. Samah. And yes, anything not sure 100%, not jargon, should avoid. Yes, exactly. I agree. Most welcome, Dr. Samah. Thank you for your practice. Please, whenever you want to comment, you can use the verbal, and to get
Okay.
more confident. Yes. Okay.
Maybe this serves other stacking. Okay. Inshallah.
Okay, inshallah. Hopefully. Okay. Thank you all for sharing with me this time. See you tomorrow, inshallah, with another day, maybe clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام. مع السلامة.